Good afternoon, everybody. We're having to do a redux on this because the first one we had a few technical issues. So my name is Dr. Robin Kearney Frazier. I am the project leader for the Service and Working Dog Handlers Guild, which falls under the Guardians Guild, where I'm also the president of Guilds of Requiem. That's a mouthful, but it's kind of how it works. I don't serve directly under myself, but gives me something to do to keep life interesting. So this month, November's actually, we're working on redoing this and getting it up as quickly as we can. I know this is redundant because obviously you're seeing it, we've already done it. This is the November 2022 meeting for Life with a Service Dog, Part 3, Contact with First Responders. Now I do have to state a few things here. We did reach out to several agencies for their information on this. Several were non-commental. One of them did tell me that if this information was directly linked to their agency, it could cause some PR or other issues that they declined to have their actual names to be listed or stated. So when you hear me say, law enforcement agency, hospital, EMS, know that they're generic and it's a compilation of the answers that were consistent between all of the ones who did respond to my emails. So let's get started. As always, we're going to have you meet our staff. Currently, it's just me present today. I am the project leader, Robin Kearney Frazier. We do reside in Pipe Creek, Texas. We do have a trainer. Her name is Megan Perkins. She is in Santa Fe, New Mexico. Renee Smith with Street Dog Rehab and also the human end of the leash. We do have several training applications pending right now that as soon as I'm able to, I will go through them and start answering and bring more people on board. That's always exciting. Colleen is one of our longtime handlers. She has had a service dog for several years now, and she's one of the people who chose to train her personal dog to be a service dog. Currently, I do not have any guests from various regions. We are pretty much, I think we've got members in 4 or 5 different states now. You do not have to have a geographical location similar to us. The only thing that makes easier is for us to help you locate a trainer where you are at. If you do not see a trainer on our website for your region and you know of some trainers who would be interested in joining our network and being a Service and Working Dog Handlers Guild representative for your area, please have them contact us at SWDHD, that's shorthand for Service Working Dog Handlers Guild, at guildsofrequiem.com. You'll see that email address later on and in the comments. Typically, our Guardians Guild Master Assistant, Mikey Gravely, is here with us. We're hoping that maybe in the future, our new Guardians Guild Master, Anne Rue, will be able to join us. She's, as with everybody, personal and family lives come first. Our Technicians Guild Master is Matthew Frazier. Why do we include him? Because anytime we dream of something, he gets to build it. About our program. We were founded in 2017 as a Service Dog Handlers Network of Bandera County. Our initial meeting had 2 people. By the time we had to shut the meetings down at the end of 2019, we were having upwards of 20 teams at our meetings. We're hoping to get back there again. In 2020, we saw the addition of therapy dogs to the network. When we know that the world pretty much shut down in 2020, and that made it very challenging for the people who do have therapy dogs or who have service dogs that depend on group training sessions and being able to go out in the public and work on their skills, especially service dogs. So we had a couple local therapy dogs that requested to join our program, and we welcomed them in. That way they could at least attend on some of the meetings and we could do some virtual training with them and help them stay in top form. 2022, this has been a year of really big change for us. Our program was updated to include all working dogs, and we changed it to a guild. And what this means is it's a sub-guild. It can stand on its own. It may need support from more than one guild, and it also has the option for membership fees based on the charter that members have created. We are now about to offer a dog training externship, which is if you are in an online school and you live somewhere where you're not allowed to have dogs, we will have a list of dogs available where their handlers or owners are willing to train with you and help give you guidance as you put theory into practicum. We also added in liaisons from our Merchants and Resources Guild, which is our marketing and business administration departments. We set a recommended trainer's fee guidelines for service dogs only. Trainers are welcome to train their normal rates for the basic trainings. They are welcome to have their own rates for when they're training for guard dog, for anything else. But as soon as a client says that this is going to be a future service dog, we are asking that they implement our recommended training fee guidelines. The reason this is that a lot of people who need a service dog are on fixed income, that they are opting to owner train or owner assist train. And when it's owner assisted train, that's where the trainers come in. We still want to keep it affordable to them. So we have set we consider reasonable amounts after polling our members. We are working towards creating a network of preferred care providers for all working dogs. What this means is if there is a dog grooming place or a pet supply online or in store that is willing to take membership cards and give a discount to our members, we will be listing them. And we're trying to locate and list some of those hard to find but highly necessary gears for your service dogs. This came about when I had service dog Cletus for a while, in that he is a Great Dane Belgian Shepherd, which means that his paws are the size of the palm of my hand. You cannot commercially find any dog shoes to keep his feet safe off of a hot summer Texas asphalt or cold winter or whatever terrain he's walking on. I had to custom make them. So we're trying to find anybody else who can help custom make things and add them to our preferred care providers. We also saw the start of our Rescue to Hero with 4 Paws program. And what this is we take in a rescue mother with puppies or about to have puppies. And once the puppies are about 8 weeks old, we start to rehome mama dog. During the time that she's with us, we will try to work on rehabilitating any issues that we see and that we feel we can correct. The puppies begin getting their training as soon as they're able to be away from their mom at short periods of time. We just adopted out Odin Thanksgiving weekend. He was 4 months old. Already knew a lot of his basic commands. We're certainly excited to watch him and his new handler grow. We also opened it up to the government-owned canine teams are eligible to join. And the reason this is that they need group training too. Their working dogs are trained for specific tasks, but they're also trained to be out in public without being reactive, without a cause to the elements around them. Having group training sessions with dogs that are other than working canine units helps them expand their criteria on that. Service and therapy dogs will remain our training focus. A lot of that has to do with this. These are the 2 areas of working dogs that needs the most help. And a word on emotional support animals. We are constantly asked if, well, I have an emotional support animal that goes with me everywhere. Whoa, 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 whoa. We stop them right there. The ADA does not recognize emotional support animals as a working class of dog. If the dog is there just to provide emotional support, it is not a service dog and does not have the accessibility rights of a service dog. Doesn't matter if you've registered them with one of those fake websites, they have no access rights. What's going on with the future of our program? Our 2025 goals is to have a meeting and training facility with indoor-outdoor kennels for canines and other working dogs in training. We hope to have a network of foster training families for the rescues that we take in. What this means is that from the time that a puppy can leave their mama till the time they have their first official evaluation at 6 months, this foster family is working with training that dog on the basic commands, including housebreaking. We're going to be offering dog training and externships. We hope to have an established relationship with several preferred pet care providers who will give discounts for the Service and Working Dog Handlers Guild members. We'll have membership cards indicating if you are a trainer, if you are a handler, or if you are a foster family. These cards just simply indicate that you are a member. It does not confirm nor deny the level of training that a dog may be with you has. And we're looking towards getting grants to ensure that a person in need of a service dog will have one without regard to their economical status. For any dogs that wash from our program or retire but still have many golden years ahead of them, we're aiming to have a senior companion program, and we're going to be working with local Meals on Wheels groups who also have Pet on Wheels programs, which is ensuring that pet food is delivered in a timely manner that gives us somebody who is regularly checking in on our senior companion and the senior they are with. We're aiming to have Requiem Ranch kennels for dogs that are just too old to rehome, or the dogs that are returned to as a part of our almost no questions asked policy. Why do we say almost? We do need to know if they have developed aggression issues to ensure that we are not setting them up for a failure in a future home. My tongue's not going to cooperate with me. So, things to remember when you have a service dog. Part 1, handler's rights. As a handler, yes, our service dog is considered a medical assistive device. When I say our service dog, that is because I have had a service dog pretty well consistently since about 2006 to 2007. It wasn't until 2013, 2014 when my service dog began to come with me absolutely everywhere because I had a medical need and she was now task trained. Many states do have laws that make interfering with your service dog as a crime. Yes, there are places that can legally not allow a service animal, and that's one of the things that our handlers need to remember, that if the presence of your service dog could interfere with the safe operation of their establishment, then they have the right to refuse entry for your dog, but they have to make an accommodation to your safety. Like I just said, they do have to provide acceptable options of different medical assistive devices to ensure your safety. Yes, you and your partner can be in a restaurant seated in the same area as everyone else. Most locales have health and safety laws that prevent a service dog from being in the kitchen of a food establishment. That is very important to remember. There is a distinguishing line between where patrons are allowed and where patrons are not allowed. If you are working for somebody that does food service, they have the right to tell you no, because the presence of your service dog in the kitchen can pose a health and safety hazard just by their mere presence. So yes, again, businesses can ask you to leave if your partner is not following public access guidelines and you are not taking steps to regain your partner under control. What are some of these things? Barking uncontrollably, pulling on a leash uncontrollably or without reason other than to go play with another dog, excessive sniffing, defecating in the premises. Those are many reasons on why they can ask you to remove your service dog from their business and allow you to come back in without your dog and provide a reasonable accommodation. So this goes along with our second thing to remember, handlers' responsibilities. Like it or not, the moment you step out in public with a service dog, you are what's considered a brand ambassador. This might be the first time someone has met a person with a service dog. When I first moved to Bandera County, I started coming up here in 2014. Almost nobody here knew the laws behind service dogs. There was very few people who actually had service dogs that felt okay to come out to the public. And until they started seeing our program being advertised, we started working with some of the businesses to let them know, hey, these are what you can and cannot do when somebody has a service dog in your establishment. And, Bandera was already pretty pet friendly, but they weren't aware of what was happening with the service dog. So just remember, just because you may have had your service dog for a long time, doesn't mean that the person meeting you has ever seen a team before. So we ask that you always be polite, even when you're declining to let them pet your dog or answer questions or anything else. Please remember to always be polite. The reason this is so the next team that they meet does not have to fight an additional battle to public access. Clean up the poop, even if it's done outside. No, seriously, clean it up. There's nothing worse than stepping in a stinky dookie or seeing another team where the dog lays that golden turd in a grocery store, and the handler's aware of it because they've stopped and they've looked at their dog, possibly said a comment, and then walked away when the dog was done. No, seriously, clean it up. That's a responsible dog owner thing to do. We also ask that you be aware of local ordinances. Living here in Bandera County, we have very few local ordinances pertaining to our pets, other than rabies vaccinations. When I was looking at living in San Antonio, which is Bexar County, they had extra ordinances that had to do with a pet or a dog in general. Regardless that it's a service dog, you still have to be compliant with local ordinances, which means if you're living somewhere where you have to register your dog with a city or a county official, you register your dog with a city, county, or official. If you have to have certain vaccinations for your dog to be out in public, you have those vaccinations. And it's also just a matter of keeping your companion safe as well. Point of notice here, the American Disabilities Act of 2010 has the most freedoms and restrictions on service dog guidelines. What this means is states and other locales can add additional privileges to service dog teams. They cannot add any additional restrictions outside of local ordinances that are dealing with regular pets. They cannot add an additional restriction specific to a service dog team. An example of this, Texas grants service dogs in training, that's what SDIT means, the same access right as a trained service dog. They do say when accompanied by a certified trainer. But since the American Disabilities Act allows you to own or train, that is how, I guess, the legal loophole to anyone can work with their service dog in training in public. Second example is Texas also grants full access to a team with a miniature horse as a service animal. And man, when I found that out, and we just went through service dog number 5 because of old age or injury, I seriously started looking at that and found that miniature horses can have up to a 20-year lifespan, of which 16 of the years, you get your first 2 years of training, and then usually about the time they hit 15 or 16, you retire them. But the problem is the miniature horse itself is very, very expensive. And if you think finding somebody to train a service dog is tough or expensive, cost prohibitive, try researching to find somebody to train your miniature horse. Makes you really reconsider having one of those as a service animal. On to today's webinar, contact situations with law enforcement. What do we mean when we say a contact situation with law enforcement? This is any time that you and your partner have an interaction with somebody who works for a law enforcement agency. That's going to be your police departments. That's going to be your county sheriff's officers. This is going to be your state deputies, federal agents, anyone who's deemed to be a law enforcement. So what do you need to know if you get pulled over? First of all, let the officer know that you have a service dog with you. They may ask if you are able to step outside of your vehicle without the assistance of your service dog. They might also ask you to ensure your service dog is restrained in the vehicle. We do have a favorite maker of Kurgo that makes a dog seatbelt that clips to your dog's harness and attaches to the seat they are sitting on. That is a safety thing that we encourage all teams to have. One of my service dogs was in the auto accident with me, and it greatly reduced his working years because he now has acute arthritis several years before he should have. So unless you know you have a history, that means you're aware you have unpaid fines out there or a warrant out for your arrest, or you have otherwise broken the law, and this is probably DUI, you're swerving or something, blinker is out, whatever. 99.9% of the time, they will not take you to jail nor separate you from your service dog. They are there to ensure your safety as well. It may not feel like it sometimes, but that is what our job is to do, is to serve and protect you, including your partner. So say you gotten pulled over, you got a warrant out for your arrest, and you're going to be arrested. So if they are arresting you, they typically will give you the opportunity to contact someone to come and retrieve your service dog. They are not responsible for the well-being of your service dog. nor are they required to transport your service dog with you when you are being arrested. This is the same with any medical assistive device. I worked in the Nueces County Sheriff's Office for many years. There was a lot of times that we arrested somebody in a wheelchair or with a walker or an oxygen tank. We did not transport the wheelchair or the walker because we knew we had those at the jail. The oxygen tank, it was not safe for them to be without, so that went with them. It was a very rare occasion in where we were arresting somebody with a disability that was using a medical assistive device. And I state here, unless it's an oxygen tank, they're not required to bring it to you or any of your additional sensitive devices that are available at the jail. Some agencies, depending on how big they are, their funding and their ability, might transport your service dog with you and then contain them in a canine kennel on the Sally Port, which is where they transfer prisoners from the vehicle to into the jail until someone you contact comes and takes possession of it. But this is not required of them by the ADA. And of course, we still have gremlins. What do you know if I'm being arrested? That should cover a lot of it. If you're not sure if this covers to your situation, reach out to your local law enforcement agency. Many of them have a public relations officer that would be more than happy to discuss things with you. Preparing for a medical emergency. Nobody wants to go to the hospital. Nobody wants to go to the ER. I can guarantee you that all of us who are disabled, that's like the last thing we want to do because, we're tired of seeing them too. So what do you need to know before a medical emergency? First things first, contact your local EMS provider that is close to your home and or work if you're still working, and talk to them. Ask them what their policies are. Have an introduction day with your service dog and some of their staff. This is a prime opportunity to teach your service dog that somebody in a specific uniform with a certain smell that goes with being an emergency medical personnel, that they are safe, that they are helped. So if something happens and you are in distress, your service dog knows that they can allow this person near you. Contact your nearest emergency room department. Where we're at out here in Bandera County, we have one of two choices, either Methodist Bernie ER, or we've got Methodist in Helotes now, or Baptist in Helotes. I think we've got a couple other ones too that might be nearby. But contact them or contact the hospital that administrates them and talk to one of their public service agents or public relations personnel so that you can find out exactly what their policy is. So that's what I'm saying. Find out what their policy and procedures are before you have a medical emergency. Have an introduction day. Coordinate with their public relations officer on a day or time when you can come down where they might already be having a staff meeting for emergency personnel so that you can introduce your dog to the smells of the emergency room, hopefully not interfere. They always have the right to say, okay, we got really busy unexpectedly, so now is not a good time. Either hang tight or, can we reschedule for a different day? Have two different people for first responders to contact in event of emergency and you need to be transported. Most of the time when we're having an emergency and we're needing to be transported, we are at home. That means they do not have to bring our service dog with because our service dog is already somewhere safe and secure. I always make sure that I've got a little key fob that has a QR code on it. And if you go to our Facebook page, Service and Working Dog Handlers Guild, our pinned post has to do with how to get your own QR code. And on there, you can put comments for emergency medical personnel, who to contact to come and get your service dog. You can also put the name of your service dog and a picture of them. So if you're in an auto accident and there's no dog with you, they have something to go on to start locating where your dog may have taken off to, possibly pretty scared and injured. So make sure your contacts know that they are contacts. There's a couple of times where we had somebody say, yeah, this is my service dog. You need to have, you need to call this person to come get them. And we call that person and they're like, huh? Say what? I didn't know I was supposed to do this. So make sure that your contacts know that they are your contacts to come and get your service dog. That also means your service dog needs to be used to being around them because they're going to be scared. They're going to be frightened because they know there was something happening to their most precious thing in the world. And so they need somebody that they recognize. We frequently recommend that if there is a trusted family member or friend or a trainer you have already been working with, that is something you need to make sure you work out with a trainer beforehand of what if I have a medical emergency. What does the ADA cover when it comes to transporting me to the emergency room? So this is going on more about a medical emergency. Once again, check with your local fire and EMS station for the service dog guidelines. They are not required to transport your service dog, especially if it will interfere with providing emergency medical care to you. That is highlighted for a reason. That is the defining aspect. That is a judgment call by those in EMS staff. If having your service dog with is going to prevent them providing care for you, they do not have to transport it. As someone who has had service dogs as small as 10 pounds to 210 pounds, I can guarantee you their answer was a lot different when it was my 30-pound Boston Terrier Boxer versus my 210-pound Great Dane Belgian Shepherd. There's physically no room for him in the back end of an ambulance. That's just how it is when you have a really big service dog. If they are transporting you and you are stable, they might transport your service dog with you. Again, that is a judgment call that they need to make. Before they get ready to go, they're going to be calling their information into the emergency room, including that you have a service dog. They may make a judgment call on that and that they have no way of assisting somebody with the service dog, and they will advise them to not transport the service dog. The preference is that one of your contact people designated by you come and retrieve your service dog from either a public location where you meet them at or at a specified location in the emergency department. We did have a couple instances where I was transported with my service dog, and Wicket made a lot of friends at the nurses station and may have made the rounds to all the other patients in the emergency room, made friends with everybody in the waiting room before my husband got there to collect him. Wicket is one of those dogs that was borderline service dog and therapy dog. I worked at a university where he was in constant contact with students, and if I was sitting at my desk, was for students to come behind my desk and sit down, have Wicket curl up in their lap and help calm them down from whatever stress or anxiety they were dealing with. So that is a big difference between a lot of different things. So if they are picking you up from your place of residency, they are not required to transport your service dog with you because your service dog is already somewhere safe and secure. And this is a policy that many stations have on all durable medical equipment. I ran into a medical emergency earlier this year, and we had to spend a lot of time trying to figure out where my wheelchair went, because they loaded me from my wheelchair into the stretcher, into the gurney, and into the ambulance, and then I was hospitalized. And then we had to play Where's Robin's Wheelchair. It's not a fun game to have to figure out where it's at. The good news is we did find it. Oh, my camera's too low for you all to see that I do have my wheelchair and I am back in it today. Handler rights in the emergency room. When you arrive at the emergency room via ambulance, should EMS have made the decision to transport your service dog with you, they will notify the emergency room of the situation. They typically do that when they call in and they give their ETA along with your stats to help the emergency room prepare for your arrival. They know that they then also have to prepare for your service dog's arrival with you. They will again ask you if there's someone that can be called to take physical possession of your service dog, and that is there for the safety and security of your service dog. That's not them being dicks, not them being assholes, not them being any number of terms that I've heard. They are there to take care of you. You are their primary patient, not your service dog. The best practice for handlers is to contact the hospital administration office prior to an emergency and ask what their policy is. Also ask them about different scenarios that are possible and how it affects their overall policies and procedures on service dogs. Say that your, DPS follows behind, you've had an auto accident on the highway, DPS follows behind with your service dog, and you arrive, and then they arrive. And so then you need to know who at the hospital is possibly going to take and keep your service dog safe. That's always a very big question that we have to think about as service dog handlers that the normal person doesn't really think about. And frequently, this policy is the same among many stations and hospitals and emergency rooms on durable medical equipment. What do you need to know about the emergency room visit when someone I know transports me? So that would, the scenario to that would be is I'm at home and I suddenly don't feeling good, but it's not a major emergency, but we know because of all my pre-existing medical conditions that an urgent care center will just refer me to the emergency room anyways, regardless if it's a full emergency or not. The recommendation is leave your service dog at home. We will not try to take our service dog with us when I know I'm going to the emergency room. I'm going somewhere where people are there to watch me and help keep me safe. If they must come with you, staff members might ask the person who brings you to remain in control of your service dog. That might be in your room where they're treating you, or that might be out in the waiting room. A few hospitals, and this is probably your larger ones, might have a provision in their hospital policy about service dogs that are different than being admitted. Ultimately, you are responsible for the safety and well-being of your service dog and all durable medical equipment you bring with you to the emergency room. Yes, on several occasions of going to the emergency room, my wheelchair got used for another patient because it was sitting in the hallway. We quickly learned to put my name on everything. So, that was my life? Yes, it is. If you've got any questions or comments, if you are a handler, if you are a first responder, or you work at a hospital and emergency room, please get your public relations department permission first before you post any information as a comment or a question or an answer to a question on our website, on our YouTube channel, or on our Facebook pages. Remember, unless you are the public relations officer, you shouldn't be answering questions with, well, this is what we do, unless you've got their permissions first. Please ask your questions in the comments below on any video where you see it posted. We do monitor our social media pretty much all the time, since we are an international organization. Somebody should get back to you, somebody knowledgeable, let me rephrase that, somebody knowledgeable should get back to you within 2 to 4 business days with an answer to your question. If you do not hear anything from somebody, please reach out to me. As the president, I try to make sure that I've answered all the questions, or I've had people answer all the questions. My email address is requiemranch@gmail.com, and it will be in the information section below. Thank you for your time and being here. We are glad that you make it, and we hope to see you at future webinars.